a member. And here's what I can tell you, man. Just as a member, we were spending $1,600 a month for health insurance for 10 years. We spent over $200,000 just in case. Okay. When we got onto Impact, we went from 1,600 to 650. That's been 3.5 years. We've saved close to $40,000 already since we've been a member. That's significant money. In addition to that, as a provider, here's a couple of things. So if you're ever getting pushback from a provider, here's what they need to know. One, the credentialing. All that means is getting approved by insurance companies to accept it. Normal credentialing for the big insurance companies, a year and a half. Okay. With Impact, we filled out the paperwork and we're ready to go credentialed in 30 days. Unheard of. Unheard of. We were able to accept people with Impact. That was amazing. Okay. In addition to that, we saw that we're getting paid between 20 to 30% more per service that we provide in our clinics, which is also amazing. So it's just been unbelievable as a provider, and we get paid within 20 days. So think about that as a provider. We have colleagues that have closed their practices because, they've closed their practices because they're not getting paid enough and they can't keep up with the cash flow. So they're taking jobs back in big hospitals and shut their practice down. With Impact, do not have that problem. It's been incredible. One story I want to tell you guys as a provider as well. We had a woman come in with 3 children right before school started. 3 kids needed physicals and shots for school. Now she had no insurance. That's $1,800, $600 a kid. After the thing, she was like, "Hey, can I put it on 2 credit cards? Can I do this and that?" So the medical assistant in our office, Maria, said, "Why don't I come here? Let me show you affordable healthcare that we accept here." She gave her a quick quote. She left paying $300 and change for her and her children. And we said, put that $1,800 away. And we have up to 6 months to build this business, so don't worry. She looked at us like, what just happened to my life? So, just so proud just to be a provider. So when, just let providers know that these things are happening. The only reason why a provider does not take insurance is because they're worried about getting paid. There's nothing else. Okay, if we can show them that getting paid is effortless and easy and smooth, they will accept the insurance. Now, one thing that Jeff had mentioned, yes, we're in next 30 days, we're expecting our second child, a little baby girl, so we're excited. And, I'll tell you, Mara's doctors at Columbia Presbyterian Hospital here in New York City, which is the largest hospital in New York State, very prestigious hospital, amazing. So when we started going there, they didn't accept Impact. So Mara was talking to them. So what had to happen was they would bill us and then we would get reimbursed by Impact for the first probably 4 or 5 visits. But Mara kept asking the billing department, have you called Impact? Can I have them call you? She didn't give up. By the 5th visit, they called us and said, we will no longer be billing you. We spoke to Impact. We will be billing Impact directly. Ladies and gentlemen, this is Columbia Presbyterian Hospital. If you know about New York or from New York, ask people about Columbia Presbyterian. It is the largest hospital in New York State. So right now at Columbia Presbyterian, they accept Impact Health. That is major. So I'm just telling you, if you talk to your providers, let them know that Impact exists. Right now we're about 25% Impact. I can't wait till we are 90% Impact, 10% every other insurance. That's our goal over the next handful of years. So as you can see, I'm excited. As you can see, we're saving money personally as a member and as a provider. It has been the best experience that we've ever had with any insurance. So thank you so much, Jeff and Melissa, for allowing me to share. I hope that helped everybody, and everyone have an amazing day. Thank you so much. I'll stay on for a sec, Jeff, if you have any other questions.
Yeah, no, Rick. Well, first off, thank you for being on today and sharing your, story, guys. I knew Rick's story personally, so it means a lot to me to have him on here and sharing. We're praying for Mara and for the safe delivery of your little girl here in the next 30 days. It's a busy time for you guys with the business and pregnancy, and here you are on today. But for the clinics, you were saying that right now, 25% of your clients for coming in the clinics now run Impact and using Impact as they come in.
Yes.
Yeah, that's exciting. And for those of you guys
Huge.
wondering, is there a business opportunity here as well? The answer is yes. So Rick and his wife Mara, they're also referral partners with Impact, just like whoever invited you on the call is a referral partner as well. So if you're wondering, is there a business opportunity here as well? The answer is yes. Rick and Mara actually have Impact pop-up banners in their waiting rooms with a QR code that their patients can actually scan and get a quote, right then, and it can actually sign up as Impact members right in their waiting room because them as the provider, Impact's paying them faster than they were getting paid for the insurance company. So how many of us see how there's value for them as providers? Plus, because they're also referral partners through Impact's marketing company, they're also making a residual income by saving their patients money on healthcare. So they have patients that they're saving hundreds, in some cases over $1,000 a month on healthcare. Now, if your doctor saves you $1,000 a month on your healthcare costs, how many of you are going to recommend that doctor to other people? How many of you that's now your absolute favorite doctor? And here's what's amazing by helping, look, Zig Ziglar said it best, if you can help enough people get what they want, you get what you want. And by helping his patients pay less, not only is his clinic getting paid faster, but now they're also making a residual income by being a referral partner with Impact's marketing company. And so if you're on the call here today and you're wondering, is there a business opportunity here as well? The answer is yes. So if you want to learn more about how to make residual income by referring Impact through their marketing company, we help individuals, families, small businesses. Just that's not really what the purpose of this call is, but I just wanted to put that out there. So if you are somebody who wants to learn more about the residual income opportunity, get back to the person that invited you on the call and say, hey, I want to learn more about the business opportunity as well. You don't have to own, medical clinics like Rick. This is something that anybody can be a part of. So if that is of interest in you, again, get back to the person that invited you on the call. Rick, any other last things that you want to share that you thought would be helpful for anyone?
Well, I just want to reiterate, do not hesitate talking to providers. Start with your own doctor. Also Impact prepays the first visit. This is unheard of. They will prepay the doctor the first visit as you go. This doesn't exist anywhere else. So please talk to your providers. We need to get this spread out even more throughout the country. So talk to your providers. They are going to be pleasantly surprised when they see the simplicity of working with Impact.